Assalamu alaikum. We will start the clinical consultation day. We have Mr. Ronaldo, 35 years, with complaint of diarrhea. Okay, ready?
Yes, start.
Yes, here you go.
Hello,
Hello?
I'm Mr. Ahmed Senior House Officer in this clinic today. Can you confirm that you are Mr. Ronaldo, 35 years old?
Yes, I am.
Okay, I'll take from you some notes and also I will examine you.
Okay.
Is it okay with you?
Yeah, doctor.
Okay, it came to my knowledge that you have loose motion. Can you tell me more about this?
Yes, doctor. I'm so sick, doctor. Since 1 week now, I have loose motion.
Since 1 week, I'm really sorry for that. This first time to get this loose motion?
Yes, doctor.
Uh-huh. Since you start is increasing, decrease or the same?
The same, doctor.
This loose motion always with you or is it on and off?
No, since it started, it's with me, doctor.
Sorry? It's continuous?
Yes, it's not not off, always with me.
Always with me. Okay, with you. Okay. دكتور باسم بس دقيقتين بس هيكون ما في اصوات وازعاج دقيقتين
Okay,
بس.
okay.
Okay. Okay, Mr. Ronaldo. You said that since it started is continuous.
Yes.
How you compensate this? You drink
I'm
plenty of.
trying, doctor. Yeah, I'm trying to take water and juice, but still the loose motion with me.
I'm really sorry for that. Okay, regarding this loose motion, how many times during the day?
4 to 5 and sometimes 6.
Okay, Mr. Ronaldo. This loose motion, it's associated with any blood.
No,
How you estimate the amount? Is it large, moderate, or small?
moderate to large, doctor.
Is it containing any food?
No, it's watery.
Water. Is it bulky sometimes?
No, doctor.
Difficult to flush?
No,
Any pain while passing this loose motion?
doctor, I feel severe colic while passing this loose motion.
I'm really sorry for that. This colic since when? 7
The
days
same
also?
duration. Yes,
Where is the site exactly in your tummy?
all over my tummy.
Is it crampy or is it dull or stable?
Yes, like
What is
crampy
the
one,
nature?
colicky one, colicky.
Is it going anywhere like your back, for example?
No, no,
Colic.
all over.
How you score this pain from 0 to 10, which 10 is most severe?
It's 5 only, doctor.
I'm really sorry for that. Now you feel this pain, so I can help you by giving you a painkiller.
Thank you, doctor.
Okay, you have any soreness in your mouth?
No, doctor.
Any pain in your joints?
No,
Any skin rash or skin change?
no, doctor.
This pain and this loose motion, even at night,
Yes, doctor.
awake you from sleeping.
Not really, doctor, but still, it's coming overnight.
Mm-hmm. Mm-hmm. Okay, beside that, any throwing up?
I feel sick, doctor, but not throwing up.
Mm-hmm. Any difficulty of swallowing?
Yes, doctor, I feel some difficulty to swallow.
I'm really sorry for that. This difficult swallowing started when?
Maybe 1 month back.
Mm-hmm. Is it started for food or for solid?
For both.
Both together. Is it
Mhm.
you feel that any food particles coming back through your mouth?
No.
This difficult swallowing, is it at the beginning of the swallowing or when the food going through food
Yeah.
pipe?
Actually, I feel it
And
at the back of my tongue downwards.
mhm, back of your mouth, you said, or
Yes.
when passed down? When passed down or at the
Yes.
beginning of the swallowing?
Starting mainly at the back of my tongue
At the start.
and going
I'm
downwards.
really sorry for that. Um, any cough,
No.
any breathing difficulty,
No.
any breathing difficulty. You feel that the food is stuck in your chest.
No.
Mhm. Okay, do you have any weakness anywhere in your body?
No.
Any sensation?
No.
Headache؟
No.
أنا حاسة في شوية ضيق. Uh, okay,
Yes.
okay, you feel that there is imbalance while you are walking.
No.
Mm-hmm. Okay, any joint? You said that you have no any joint pain. You have any muscle pain?
No.
Muscle stiffness?
No.
Any cough and upper blood?
No.
Okay, you have any high temperature?
Yes, doctor, I have on and off.
Um, since when?
Since long time, doctor, I have on and off high
Like
temperature.
months or years?
Maybe 2 months now.
Mm-hmm.
Uh, I had some increase in my temperature, along with some infection in my throat.
Mm-hmm. I'm really sorry for that. This infection, is it high grade or low grade? You measured it?
Um, it's 38.5, doctor, I measure.
Mm-hmm. Anything improve this high temperature, like any
Yes,
paracetamol? Mm-hmm.
yes, it helps. It helps, doctor,
You said
yes.
that you have you said that you have history of infection in your throat, recurrent.
Yes,
Since when?
since 6 months now.
6 months. Mm-hmm. Any previous attack of this throat pain or any infection, recurrent infection since you are a child?
No, just the last 6 months.
I'm really sorry to ask you some private questions. Are you sexually active, Miss Ronaldo?
Yeah, yes, doctor, you're right.
I'm really sorry to ask you this question also if you have any extramarital relationship, for example.
Yeah, I have.
Mm-hmm, mm-hmm. Since when, Mr. Ronaldo?
Since 3 years now, I'm having multiple
Uh-huh.
partners, doctor.
Is it unprotected?
Yes, doctor.
Uh-huh. Okay. Okay, Mr. Ronaldo. You have any chest infections?
No, apart from the sore throat, no, doctor.
Mm-hmm. Okay. Any heart motion before?
No,
Uh-huh. Any history of increase in waterwork, or can you change the amount?
No, no,
Can you change the color?
no.
Mhm. Okay, Mr. Ronaldo, what any basmati illness I should be aware of?
No,
Surgical operation,
no,
any medication list you are on?
no, doctor. Only paracetamol when I have fever.
Any allergy, any medication?
No.
Mm-hmm. Okay, any herbal substances you are on?
Sorry, any?
Any herbal substances you are taking? Herbal.
No, 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 no. I am not sick.
Do you smoke?
No, doctor.
You take alcohol?
Especially.
Mm-hmm. Yeah. Okay. Um, what is your job?
Yes, I'm a coach in the gym.
You feel that your condition affecting your daily activities or
Yes.
your job performance? Mm-hmm.
Yeah, doctor. I feel like I'm not able to do this job anymore.
I'm really sorry for that. You feel that you are tired?
Yes.
Mhm. Any lumps, bumps anywhere in your body?
Yeah, doctor. Honestly, I feel some of them
Mm-hmm. Mm-hmm. This tiredness, is it at more during certain time during the day?
all over the day.
Mm-hmm. Okay. Uh, okay, Mr. Ronaldo, you have any traveling history?
Travel, yes.
Mm-hmm. You have any contact with anyone has long standing cough?
No.
Any night sweat?
No, no, doctor. Not really.
Uh-huh. Okay. Mm, I'm really sorry to ask you some private questions also. You have any discharge from your private area?
No.
Mm-hmm. I need to examine you, no?
Yes, sure.
Um, okay, I want the vitals of the patient.
Yeah, blood pressure 90 over 60
Mm-hmm.
and pulse rate is 100.
Mm-hmm. Okay, I will check if there is any signs of dehydration, any dry
Yes.
mouth.
Yeah, he has
Yes.
mild, mild signs of dehydration. Yes.
Mhm. Yes. Also, I will check if any color or jaundice.
No jaundice, no pallor.
I will go to the abdomen to see if there is any tenderness.
Uh, Not specific now.
Uh-huh. Okay, then I will check the mouth to see if there is any enlargement of the tonsil,
Any what?
enlargement of the tonsil, or any signs of
No,
inflammation or fungal infection.
no,
Mhm.
no,
Okay. Also, I will check if there is any hyperpigmentation around the mouth, for example, or
no,
skin care. Um,
no,
then I will check the chest also to see if there is any crepitation.
no, it's clear. 2 minutes
Um,
remaining.
what is your concern, Mr. Ronaldo?
What I have, doctor, why I
Uh,
have this loose motion?
okay, Mr. Ronaldo, from what you said to me, I have to examine you. Most likely, the cause behind this is an infection called human immunodeficiency virus, which is called HIV. I'm really sorry to tell you this. And this is actually most likely related to this multiple partners. Um, maybe you got infection from any one of them. I'm really sorry for this, Mr. Ronaldo. And I want to assure you, we are here to help you. We will do for you further tests. Um, and to confirm that, and also we will do for you image, not emission, camera test for your food pipe. And After confirming that, we will consult for you infection specialist or pack specialist. I mean, um, and also gut doctor. Uh, they will put for you some plan of management. We will sit with you and discuss with you about this plan. And also involved with us, the doctor and a mood doctor, because this I think it will be stressful for you, but we will support you, Mr. Ronaldo. We will also occupational health worker to give you some advices um, to support you at your job. Any other
Okay,
concern?
okay, time is up. Okay, let's go to the examiner question. What's your case about?
My think about diagnosis. It's HIV infection with um, with opportunistic infections involving the GIT in the esophagus and an
Okay,
intestinal infection.
okay. So, what other possible differential?
Possible other possible differential can be also tuberculosis infection, and also can be cancer. Again, is that no constitutional symptoms going with this. Can be lymphoma. Can be lymphoma. Um, and also
Okay.
can be yes, that's all.
What infections in the GI, in the case of HIV?
Infection
What are
can
common?
involve yes, can involve esophagus bifungal infection candidiasis. I mean, and also can be infection involving um, the
No, for the diarrhea,
intestine.
for the diarrhea. Yeah, for the diarrhea.
Can be cryptococcus and في واحد كتب الاسم cryptococcus can be
Ye-
cryptococcus infection.
Yes, this is one of them. This is the commonest. Yes. What else?
I can't remember. It's Spyro. I could not remember it.
Okay. Uh, how to investigate this patient?
I will do basic investigation. Apart from that, I will do investigation to confirm by HIV screen after counseling the patient. And also, I will do investigation of the complication. Um, I will do endoscopy, upper GI endoscopy, and uh, I will screen also for TB.
Sorry.
The,
Okay, Dr. Atif, go ahead.
yes, also I will do a screen for TB infection also.
Okay. Will you do
I also
stool analysis culture?
yes. So analysis and culture, and also I will do a biopsy for the lymph node.
Okay. How to manage this patient?
I will consult the patient about the condition, uh, and also I will put the patient refer patient to multidisciplinary team involving in infection specialist and gastroenterologist, occupational health worker, psychotherapist, and um, specialized nurse, dietitian. Gives the patient some advices as a part of counseling regarding his daily activities and also his occupational uh, circumstances, and also treat the underlying cause of infection by antibiotics, and also treat the underlying cause of this opportunistic infection, HIV treatment.
Okay. What's investigation specific for HIV in this patient?
I will do screen antibody for HIV investigation for
Hmm.
HIV. You asking? Yes.
Yes.
Yes. I will screen for antibodies, HIV antibodies, and also
By
uh,
by doing
PCR, PCR, and B24.
and B24 is the antigen. This is in the acute state.
Uh-huh. So
Do you
which
think this
PCR?
patient in acute
No,
HIV?
no, this patient not acute HIV because now he developed a opportunistic infection. I will
Yeah.
screen by PCR.
Although there is HIV diarrhea in the acute, but this patient risk factor since long time, so he might have opportunistic as you mentioned.
Yes.
So you will do for antibodies, is it?
Mhm.
Okay. If positive, what other tests for HIV you can do?
I couldn't remember it.
Viral load?
Viral load is to
Yeah.
assess the
By
degree
the
of
way, the antibodies by ELISA, the
yes.
viral load by PCR, and the CD4 count, right?
Okay.
Yeah. Okay. Some noisy, sorry. Uh, okay, I think I'm done with the question. So I will start comment. Let's start from the differential. You give HIV, yes, I agree, as underlying cause, and opportunistic infection could be as Cryptococcus, cytomegalo, and I mentioned already in the chat, Mycobacterium avium. This is as on top of HIV opportunistic infection. This first differential, you can mention three of them as differential. Then the traveler diarrhea. There is history of travel in this patient. I don't know, you didn't analyze it. So it's possible to be as a traveler diarrhea, although a patient is HIV and high risk for HIV, but still you can put it as differential. Then the other cause, as I said, lymphoma or TB. This is for the differential. So the comment starts from the onset course duration. I think you cover it well, along with the other GI system analysis. You cover all. But what do you think about odynophagia in this patient? Why he
Candidiasis.
has, yes, candidiasis.
This
But
is
he
not
didn't
much
examine that. Yeah, yes, I know you know, but you didn't examine the mouth. You asked for tonsil, but instead you can ask
uh, uh,
for the candidiasis and the on the
yes, I
mouth,
got.
on the
I
tongue.
thought I said that. Yes, I said that. To, if there is any sore throat and also for fungal infection assessment.
Okay, okay.
I didn't
Let's
say.
go back to the.
I didn't say
Okay,
to see the hygiene. This I think also important.
it's okay. Go back to the history. The other constitutional symptoms, of course, it will be positive fever, night sweat, lumps or bumps, lymphadenopathy, I mean, and feeling tired. All this can be there. Jaundice, if you suspect cytomegalovirus infection, it will be also there. The other symptoms are other system review, cardiovascular and chest. You might have dizziness, either due to dehydration or if the patient has bloody diarrhea, but in this patient, he hasn't blood diarrhea. So you might have dizziness, and you didn't ask about the dizziness. Along with the examination, also you should examine blood pressure sitting and standing, along with the hydration signs. Then history of infection, sore throat, and so on. You discover all these questions. The GUTI, or sorry, the GI system, the genitourinary system, sorry, you ask about. And you ask for any discharge from private area for any sexual transmitted disease. You're right. Okay, the family history you missed. family history. The travel also, I think you missed. Uh, the long-standing disease and the HIV, you explore the HIV from the sexual relationships. However, you can ask also for the spacing, tattooing, and sharing needles along with blood transfusion. By the way, this patient has a positive travel history. He just came back from Thailand 1 month back, so you can still think about traveler diarrhea. Okay. The occupational, you cover the job and smoking, alcohol, you cover all this well, and you can ask also anyone supporting you at home. Do you need any support at home? In the examination, it's target to examine the first, of course, I will start the vital chart, pulse rate, and blood pressure sitting and standing, and any rash in the hand, any pallor or sharing needle signs or breaking in the cubital fossa, and but this patient has also history of sharing needles, so he has a lot of risky behavior. Okay, this is for the hand. Then the blood pressure sitting standing. We finish the face for jaundice and pallor, the mouth for any ulcer or candidiasis, as you said. Lymphadenopathy is very important in the neck, along with the axillary ones. The chest to rule out any chest infection or any opportunistic infection in the chest. Then the abdominal examination, as you did, it will not be positive, but you can offer also digital rectal examination to rule out any bloody diarrhea. But the patient already denied that. Lymphadenopathy in the inguinal you can offer. And finally, the legs for any leg edema or any skin rash and
I
signs
did
of
not check the lymph
heart.
node in examinations. I forget.
Yes, yes. Yeah, we are reminding each other. Okay. Yes, I think this is the case. I didn't prepare it well, but because of the time, for the
Wallahi,
sake of
thank
the
you.
time, I
This
just,
is a
yeah,
very nice case.
yes, it's
يعني
very
did not do
important
this
topic.
HIV scenario at all.
Yeah,
Yes.
it might present either with GI opportunistic, it might present with opportunistic chest infection, it might present even with the brain infection, toxoplasmosis, and HIV in the brain, I mean. Okay, and lymphoma as well. Okay, so let's read a comment. And prepare your case for Dr. Sarah, write it down. Yes, investigation, Dr. Aisha said, investigation for all opportunistic infections, CD4 count, of course, we mentioned all these, cytomegalovirus, TB, toxoplasmosis, all hepatitis. Yes, of course, whenever you screen for HIV in patients risky and sharing needles, you should include hepatitis, all hepatitis screening, hepatitis C and hepatitis B. I think we can add to the history relation of the diarrhea to food for celiac, tummy pain, relief by defecation, and flatulence for an inflammatory irritable bowel syndrome, painful swallow, and thrush of for HIV. Yes, it was positive. Laxative and mood, laxatives and mood, yeah, as a cause of diarrhea. Okay. Thyroid questions. Travel history is very important. Illicit drug and needles. Yes. Thank you. Dr. Zain. Okay, thank you, Dr. Qadi. Interesting case, thank you. Dr. Watif wrote the case, Mrs. Julia, 32 years with short of breath. Dr. Sarah,
Uh,
you ready?
okay.
Okay, any question before we move to the next? Dr. Sarah, prepare yourself 2 minutes.
اوكي حضرتك قلت شورت اوف بريث عندها كام سنة معلش؟
Yes, 32 years, Mrs. Julia. Okay, any question or any concern, any comment? I think for celiac and inflammatory or irritable bowel syndrome, they present as chronic diarrhea. I agree. That's why it's not one of the differential. So not for this case. My friend examined from Doha like this case, HIV, but with skin change. Of course, skin change as seroconversion syndrome. It will be in acute state. Skin rash in HIV is very wide differential. You can find a lot of differential in the HIV.
HIV can come in chronic and acute diarrhea, both of
Yes,
them. Mhm.
yes. HIV syndrome, diarrhea syndrome, or opportunistic infection.
دكتور باسم السلام
Yes.
عليكم.
وعليكم السلام ورحمة الله وبركاته.
My friend examined from الدوحة.
Mhm.
Patient هو كان 38, I think 38 male, presented with diarrhea 9 months. And also he notes skin changes from 2 months after diarrhea onset. She said in this examiner discussion about this skin changes, why he developed skin changes. She said in the analysis of the data of the patient, he get new onset diabetes mellitus and undiagnosed diabetes mellitus.
Okay.
The skin manifestation in the bilateral legs skin manifestation, each skin manifestation.
Mhm.
هي examiner at least the examiner is a tough one and all questions difficult questions بس
It
الحمد
was
لله
cited,
she passed يعني أيوة
ما شاء الله.
كل ال side effects of drugs and discussion about diabetes with skin changes, HIV with skin changes, vitamin deficiencies related to
Mhm.
diarrheal HIV.
Yes.
The all discussion around these points.
Mhm. Yeah, HIV is very common topic for examination, and examiner they like to ask about either investigation, management, differential, complication, association. It's a very huge topic to talk about, and it might be asked for any of these categories of the questions. One of the skin rash, as Dr. Qadi wrote, is Kaposi sarcoma. It can present it in this patient. You might have also basal cell carcinoma or squamous cell or any cancer, any lymphoma. It's complicated and complex cases. I hope we will not face
She
like
said,
this
Dr.
case.
Bassem, she said this skin manifestation, according to description of surrogate, the complication of diabetes, most likely complication of diabetes. But the examiner questions surrounded around HIV complication, vitamin
Yes.
deficiencies, drugs related to HIV. What is drugs causes skin manifestations? That's the
Mhm.
discussion around this. She didn't mention Kabusi sarcoma because
Mhm.
she didn't thinking about this because
Mhm.
the skin change is acute after onset of manifestation of diabetes.
Mhm. So you can put all the skin change like
But examiner not ask about this. Yes.
yeah, necrobiosis lipotica for
even
diabetes as
examination
complication.
in after examine the skin the lesion, the examiner ask about malignancy, skin malignancy,
Yes,
because the
all
patient has
complication might happen. Yes,
immunocompromised. Yes, yes.
yes, yes, it might happen. All these complication might happen and present. Okay, thank you, Dr. Adil, for this experience.
العفو.
Thank you so much. Okay, let's start. Dr. Sarah, ready?
Okay. Hello. My name is Dr. Sarah.
أيوة okay start. Yes hello دكتور.
Hello.
Hello دكتور.
Yes, my name is Dr. Sarah. I'm one of the doctors here in the clinic. Can I confirm your name and age, please?
Yes دكتور I am my name is Julia and I am 32 years old.
Okay, can I ask you what brought you to the clinic today?
Yes doctor I have some breathing difficulty doctor.
Okay, can I ask you since when this difficulty breathing started?
I noticed this like actually like 1 month this breathing difficulty with me and it's increasing.
It's increasing in severity.
Not like before.
دكتورة معلش دقيقة واحدة بس معلش أنا آسفة دقيقة واحدة.
Okay.
معلش أنا آسفة على التأخير. السلام عليكم. السلام عليكم.
Yes.
Yes, go ahead, continue.
Sorry. So this one started 1 month ago, and you are telling me that it has increase in severity, right? Hello?
Yes doctor. Yes.
I'm sorry to hear that. Okay, can you tell me what seems to worsen the symptoms?
Sorry doctor.
Can you tell me what seems to worsen the symptoms to make it worse?
Yes. Yes, actually, I'm not sure, but I feel that this breathing difficulty is increasing in severity, not like before.
Have you noticed that it's worsening with more exercise?
I don't think related to that.
Okay. Is it related that it's more when you are sleeping, or you are flat on the bed?
Actually, it's all the day.
Okay. Is it related to food?
Food.
To after food of eating heavy meal, do you notice the shortness of breath is worsening?
I don't think that. No, not related to food.
Okay. This is the first time it happened and never happened before?
This first time.
Have you seen any doctor or you seen any doctor regarding this symptom?
I did not seek any medical advice regarding this.
Okay, sorry to be that. Okay, can I ask if you have a cough?
No, I haven't. No, I haven't.
Okay, do you feel that your chest is noisy?
No.
Do you have any chest pain?
No.
Okay, have you noticed any leg swelling?
Swelling in my legs? No.
Okay. Have you got any like sore throat or any pain in the back of your throat?
Pain in my sore throat? No, I haven't. No, any sore throat.
Have you noticed any nose crustation or any pain in your sinuses?
No.
Okay. Have you noticed any like any frothy urine or any problem in the amount of urine?
No. No.
Okay. Can you tell me if you have any fever during that month?
Yes, I feel that sometimes I feel that I have high temperature.
Is it all over the day or it comes in spikes?
No. From time to time, I feel that just my body is warmer than before.
And this has started also 1 month ago?
Actually, it's before 1 month. This 1 month, like 2 to 3 months.
And it is still till now coming to you, this warm body feeling.
Sorry?
It's still coming to you, this feeling of warm body that you are warm.
Yes, from time to yes, from time to time I feel that my body is warm.
Have you measured your temperature at the time of feeling warm?
No, at all.
Okay. Have you any sweating?
No.
Or any night sweating?
Just sometimes I have a sweating. Yes, sometimes I have a sweating, not associated with certain time during the day.
Not
From time to
specific.
time. It's on and off.
Okay. Any weight changes?
Yes.
Can you tell me more about it? Have you lost weight or gained weight?
Actually, loss of weight. Since 6 months, I noticed my weight is decreasing.
Sorry to hear that. Can you tell me how much was your weight in the beginning of these 6 months, and how much you have lost all over this?
I'm not sure. I'm not sure. Just I feel that my clothes became more wider, and this is not intended because I did not try to lose any weight.
Okay. Have you not taken any pills or anything to help losing this weight, right?
No.
Okay. Okay. Can you tell me if you have with this? Can you tell me if you have any weather preferences?
Yes. I feel that I am more comfortable in cold weather.
So you prefer cold weather, right?
Mm-hmm.
Have you noticed any shakiness in your hands?
No.
Have you noticed that you are more nervous than before?
More what?
No, more nervousness.
Yes, yes.
Have you any problem in combing your hair or climbing up the stairs?
No, doctor.
Okay. Have you noticed any change in your eyes or any eye symptoms or any eye problems?
Yes.
Okay. Can you tell me more about that? What have you noticed? Any problem, any redness
You
or
see,
any?
you see my eyes, doctor. It was not like this before. I feel that it's more prominent like than before.
Sorry to hear that. Have you any problem in your vision?
No.
Okay. Have you noticed any lumps or bumps in your body or your neck?
Yes.
Okay. Have you noticed any like racing heart or racing in your heartbeat?
Sometimes.
Do you feel it like regular or you feel it like sometimes it will be in irregular rhythm?
I'm not sure, doctor.
Okay. Can I ask you more if you had any surgeries before or any radiation over your neck before?
No.
Have you had any fever? Yani fever only started 1 month, you told me, right?
Yes, yes. Just I feel my body's warm.
Warm is warm.
It's just fever, high temperature. Yes.
Okay. And you told me that this weight change has happened 6 months ago. All of these other symptoms, like the weather preference, the nervousness, or the eye problem, also started 6 months ago?
Yes, it's actually not all since 6 months, but all through this 6 months.
Okay. Sorry to hear that. Have you any difficulty swallowing?
No.
Did you notice any change in your voice?
No.
And sorry to confirm again, you told me that you have no problem like leg swelling or anything, right?
Yes, I have no any leg swelling.
Okay. Sorry to ask you, are you married?
No, I am single.
Okay. Can I ask you when was your last period?
Actually, it was like two weeks.
2 weeks ago. And last pregnancy?
I'm not married, doctor. I'm single.
Okay. I'm sorry to ask a private question. Okay. Can I ask you if you have any problem like urine, change in the urine, more amount in the urine?
No.
Have you noticed any bowel changes?
No.
Have
Yes.
you noticed
Sorry, Manish. Yes. I have loose motion. Yes.
you have loose motions? How many times per day?
Sometimes two, sometimes once.
Okay. Does that wake you from sleep?
No.
Okay. Have you noticed any skin changes?
Yes.
Can you show me where the skin changes or tell me where is it?
Yes, in my leg.
In the front of your legs? Okay. Okay. Can I ask you if you have any past medical issues, any past medical history, like a problem in your health?
No, doctor. Like what?
Any long-standing diseases like diabetes or hypertension or any problem in your glands?
Yes, doctor. I have a history of diabetes.
Okay. Since when?
Since like 5 years. Yes.
5 years ago. Sorry to ask you, but what medication you are on now, or you started on for this diabetes?
Yes, they gave me insulin.
They started you insulin since since the first day of diagnosis?
Yes.
Okay. Can I ask you if your diabetes is controlled, and how is your hemoglobin A1C for the readings of the last 3 months?
Yes, it's controlled.
3 minutes remaining, Dr. Sarah.
Okay. Okay, can I examine you? يعني مشكلة. Okay, can I examine you?
Yes, okay.
Okay, can I examine the pulse, please?
The pulse?
Yes.
The pulse is high,
Is it regular or irregular?
regular.
Okay, can I see a shakiness of the hands?
What you
Any
want in the
shakiness
hand?
of the hand? A shakiness of the hand?
Shakiness. Yes, there is shakiness.
Any proximal myopathy? Signs or examination of the proximal myopathy?
Negative.
Over the shoulders? Negative?
Negative.
Can I examine the eyes, please? Can I examine the eyes? Examine.
What you want the eye?
I want to examine the lid retraction, the exophthalmos.
All of them
And-
positive?
Okay, and the lid lag. And I want to examine for the eye movement. Okay, and also I want to examine the neck.
What you want in the eye movement?
I want to check if there is diplopia, or he will see double vision while looking in different directions.
No, diplopia.
Okay, can I examine the neck?
Yes.
If there is any goiter?
Yes.
Is it smooth?
Yes.
Okay. Can I examine the chest? I want to auscultate the base of the lungs.
Yes. All negative.
Okay. The auscultation of the lungs are normal.
Auscultation of the chest, normal.
Auscultation of the lungs are normal. Can I examine the lower limbs? If there is any acropathy?
Yes, there is a rash in front of the legs.
If there is any leg edema?
Negative.
Okay. For because the patient has also diabetes, I would like to check to auscultate the heart also,
Negative.
and to check the fundoscopy.
For what?
To check if there is any diabetes, diabetic retinopathy.
Negative.
Okay, I want to check the sensation over the lower limbs.
Sensation.
The
Okay.
the sensory examination of.
Time is up, but I will add 1 minute for the concern.
Okay, can I ask? Sorry, can I ask what's your concern?
What is my problem? Why I have this breathing difficulty since 1 month increase?
So by taking history and examining you, I think that you have activity in the gland in your neck that's called thyroid gland, and it's secreting more of something we call secretion of more hormone or protein. Sorry for the medical term. And this protein has led to all of the symptoms that you have, like the eye symptoms and the change in your bowel. Short of breath. I did not reach. Sorry. طبعا I will not her, but I couldn't reach for the cause of the short of breath. But we will do more investigations, and we will do more imaging study to try to reach diagnosis and to help you more.
Thank you.
Any other
Okay, time
concerns?
is up.
Okay.
Thank you.
Okay, the examiner question, Dr. Atif, start.
What is your differential for the case?
So I think the patient has Graves' disease associated with type 1 diabetes, associated with other autoimmune disease, type 1 diabetes mellitus.
What else differential you are thinking about?
Could be other causes of hyperthyroidism. But again, it said that the goiter is smooth in the neck, and the patient has eye symptoms. So the most probable differential diagnosis is Graves' disease.
You exclude the other causes of hyperthyroidism?
No, but because of the patient, most probably Graves' disease will be associated with other autoimmune disease like diabetes, and also Graves' disease is associated with eye symptoms.
Okay. What is the investigation?
So first of all, we will run some basic investigation like CBC kidney function tests, and then because she has this shortness of breath, we have to do chest X-ray, and to do pulmonary function test also to diagnose the cause of her shortness of breath, and also if the chest X-ray is showing any any pulmonary edema or any pulmonary congestion, we have to make more studies over the heart, like doing echocardiogram to check for the ejection fraction of the heart, which is a common complication of the hyperthyroidism. Also, we have to run specific tests for the hyperthyroidism, like TSH 33 and 3T4, and also do the antibodies for the thyroid gland. Sorry, I cannot remember the names now. And also, we have to run ultrasound over the neck to examine more the thyroid glands. For the diabetes, we will do hemoglobin A1C to check the control of the diabetes, and that's it. Yes, I think.
Okay. Well, what is the treatment?
So the treatment of Graves' disease is non-pharmacological, patient education, and patient counseling, and informing her about the need for the specific medication for the Graves' disease, and the pharmacological treatments, either carbimazole or propyl thiouracil. In this case, we will prefer carbimazole in the beginning, and if the patient has any complication from the goiter, like she has problem in the like that case, shortness of breath could be due to the pressure symptoms from the goiter, or she has difficulty swallowing, or she has change in her voice, we will go for surgical management. Or if the patient is preferring the surgical management, we will go for it, especially especially for cosmetic reasons. Also, the radiotherapy is one.
Yes. Okay. Radiotherapy also. Okay. Thank you. What is the name of this rash in the leg?
Pretibial myxedema.
Yes. Yes.
Pretibial myxedema.
Okay.
Sorry, I messed up the name. Sorry.
Oh yes. You think that this patient is there is any need for surgery or not?
Sorry.
In this patient, if there is any need for surgery or not? In this patient.
Because she has shortness of breath, and after excluding other causes of shortness of breath, and we are sure that it is due to pressure symptoms, from the goiter, yes, it will. She will need to do surgical. She will need to do surgical management of her goiter.
Can you give me two advices we can counsel the patient about?
Advices?
Yes, advices. Any advices to provide for the patient? Okay, thank you.
Because of
Tamam.
the eye, yes. The eyes, yeah,
Yes.
she has to stop
Yes.
driving. She has to stop driving,
Yes.
and yeah, she has
Yes.
to stop driving.
Yes, thank you.
Okay,
Tamam.
thank you.
And smoking.
And smoking, yes. The smoking, because it will worsen the eye symptoms, yes.
Yes, exactly. Okay, thank you, Dr. Aata, for the case, and well done, Dr. Sarah.
Thank
Let's
you,
hear
sir.
the comment from Dr. Awata.
Okay.
Sorry.
هبدأ من last point that إنه فعلا advices regarding the eye و how to take care of the eye and to cover and give application, and also regarding the smoking as Dr. Basim said, and also regarding the pregnancy, because the patient is young. In future if she was think about pregnancy to be planned also. All of this is safety netting of the case. And also regarding at the end of the case, I think you reached the diagnosis. Why this patient have shortness of breath? Because as a compressive consequences of this swelling in the neck. So in the differential, we can our concern, I mean, tell the patient that this is because of compression of this swelling that related to this Graves' disease, and because um, you talk about that this maybe the thyroid is maybe related to this diabetes mellitus. We can put polyendocrinopathy, maybe polyendocrinopathy, maybe isolated Graves. Am I right? And also you need to exclude some other like this eye symptoms also can be not related to the case. Maybe this because of this bulging, because of there is any other cause. So we need also to exclude Hashimoto and also yes, Hashimoto thyroiditis. We need to exclude the other causes of hyperthyroidism also. In the history you took very good history, mashallah. Even that's why uh, you must think about this compression, because even mashallah you asked about compressive symptoms, even the dysphagia. Also if there is any cancer also can affect the breathing, can affect the swallowing also if there is any infiltration, but in this case less likely, because all the features not going with malignancy most likely, but need to be excluded also. Regarding the investigation, yes, as you said, but you need also to talk about the investigation that is specific for the Graves, like antibodies that related to Graves' disease. And uh, um, there is other comment I wrote it. No. Yes, about women function test, there is no need. Just X-ray, I don't know if Dr. Basan can talk about this or comment about this. Just X-ray, I don't think there is need. Yes, ultrasound neck, and also you forget to talk about also fine needle aspiration, because there is a swelling, and also we need to do uptake scan because of other differential, and also to exclude any chance of malignancy, uh, just to be in the safe side with the patient. About the treatment, yes, as you said, besides these advices also, you need to talk with the patient about the advices, even inside the concern. Regarding the antibodies, specific for the Graves, like TSH stimulating TSH receptor stimulating antibodies and anti-thyroid peroxidase. antibody. And as I told you, the scintigraphy is important, very important. Fine needle aspiration, I think there is need for fine needle aspiration. After the scintigraphy also first, because this is not invasive. According to that, we can go for this invasive test, which is fine needle aspiration or not, after ultrasound and after scintigraphy to see the uptake, thyroid reuptake scan. I mean, that's all what I have. This is my comment. Thank you.
Yeah,
Thank you.
thank you, Dr. Awatif and Dr. Sarah. We are answering the last question, Dr. Awatif. Chest X-ray for any sort of breath is like mandatory, and
Okay.
yeah, the first scan to do.
And this pulmonary
And
function test, I think there is no need. So, no anything
if there
going.
is obstruction,
Yes.
it might help as an obstructive pattern, but
Okay.
it will be major airway obstruction
In
on the
this grade, there is
trachea
no
itself.
need. Yes, and there is yes, there is a grade, there is no need for pulmonary function test. According to
No,
differentiate,
no.
and the
If
differentiate.
there is compression and obstruction, it might help. Isn't? You
Okay.
said there is obstruction, so you can mention it, but it's not the first test to do. And there is
Yes.
also an important test she missed, Dr. Sarah, in the image. What's CT? I said it. So the CT here is important. Do you think? CT thorax
Yes, you are right. Yes.
Yes, CT is very important.
for retrosternal extension, right?
Yes, to exclude retrosternal extension and to also see if there is any pressure or something.
Yes. Okay. Thank you, Dr. Atif, again for the case. We'll start to comment. Actually, Dr. Sarah, at first time, you're great, but I need you to be more fluent. Maybe because this is the first time for you. You have a lot of pauses, thinking what to ask. Actually, you don't have time to think. So subconsciously, you will ask the question after the question after the question till the last moment. And even you can miss some question if you are so fluent and still not focusing, you might miss some questions. So the advice in general, try to be more faster in the questioning. Okay, try to write scheme in your paper and follow this scheme, either system review or the occupational or the social. Put it and don't stop. Whenever you have time, either to ask or to do examination or to advise or to roll out other differential and so on. This is in general, apart from this, you did great. As a system review, you ask all questions started from the onset, course, duration, what increase and what decrease, what improve. Is that the first time and or previous time? Any association of the system, relevant system, which is chest, the cough, and noisy breathing. Then the cardiovascular for heart, chest pain, racing of the heart, leg swelling for heart failure. And by the way, you can put heart failure one of the complication or one of the differential in this patient as high cardiac output heart failure in thyroid and hyperthyroid state. The CNS, you catch the eye problem starting from the vision and sorry, ptosis and the double vision might be also there. The changes in the GI, like bowel change in the form of diarrhea. Of course, after knowing that this patient have hyperthyroidism by the specific question for that, which is preference to certain weather. In this patient, the patient will prefer to stay in the cold weather. Along with the shakiness and the sweating and the palpitation, all this will be positive in the history. And sweats and fever, decrease weight, although the appetite will be preserved. Lumps and bumps not in the body, in the front of the neck, will be in this patient. The skin and joints, the skin will be in the leg as peritibial myxedema. Okay, this is for the system review. The travel history and the family history. The family is very important, this patient, and you miss the family history. Like Hashimoto runs in family. There is some familiar, I mean, it's not genetic one, but like as autoimmune, other autoimmune, it will be running in family. The pregnancy was negative in this patient, and it will roll out postpartum thyroiditis. And this one will be as a differential for the hyperthyroid state itself. The medical history is important. Any medication, any surgery, any radiation, as Dr. Sarah asked, and the diabetes here as association with autoimmune. Okay, if you have diabetes and thyroid, what you should think about in young patient? Autoimmune polyglandular, right? Syndrome. You will add to this one. And you should ask also about vitiligo, any hypopigmentation in the skin. The marital state you ask about. Then the examination, 3 systems will be examined in this patient. Starting from the periphery, the vitals, the hand, acropachy, and any change, any tremors, fine flapping. Here will be fine tremors, sweating of the hand, and the pulse itself, irregularity, and synchronization to the other arm on the other radial pulse. It might be AF associated. Then myopathy, proximal myopathy can be also there. Then the eye itself, the second system, you will examine the eye from the acuity, fields, and reflexes, its shape ended by fundoscopy for retinopathy. Lid lag is important to ask about, along with the exposure or the cornea from the side, exophthalmos, I mean. Okay, this is for the examination of the eye. Then you will move to the neck. The steps of examining the thyroid, as we know, inspection, palpation, even percussion and auscultation. Inspection from the front, then from the side, and you ask for sip of water. Can you swallow for me? You will check it will move with them swallowing. You should ask him to protrude the tongue out to roll out thyroglossal cyst, although it's not common in this age, but roll out the neck swelling. Then from the back, you will stand up behind the patient, push from side to side. This is for palpation. And you again ask him to drink sip of water and swallow, and you notice the movement of the neck, of the thyroid. Then the consistency of the whole gland and Graves will be all gland diffuse enlarged. This is for palpation and the hotness as well. The percussion, you will percuss behind the sternum for its sternal extension. The bruit, you will auscultate for any bruit. These are the steps for thyroid. Lymph node in the neck to rule out any cancer or any infection. Then you will move to the peritibial eczema, examine it by inspection, also palpation, any hotness, any redness, any oozing. It will be non-pitting edema. Then the last step, the leg swelling for heart failure. You can examine the heart quick for heart failure signs if you have time. If you don't have time, the most important in this patient is the pulse, but you can at least do the raised GVP for heart failure. Okay, this is the whole steps in this patient. The differential as a short of breath in hyperthyroid or Graves' disease, we can put in the top compression or compressive thyroid or goiter over the trachea, then, sorry, I missed the examination of the chest. Inspection also palpation, at least the back. You can auscultate also the trachea for the narrowing of the trachea. You might hear some snoring or like wind going in the windpipe, like high-pitched voice. Okay, the differential, back to the differential, either compression on the trachea by the enlarged thyroid or heart failure with signs of heart failure, but against that, no signs of heart failure. Also, we can put here ischemic heart disease as a complication of thyroid, and also it can present with short of breath as acute Cori syndrome. I think this is the case, and the topic, the scientific point of view, Dr. Awatif covered the investigation, the antibodies, the scans, radioisotope scan, and the ultrasound, fine needle aspiration. But in Graves, no need to proceed for a fine needle. It's enough to do a radioisotope scan. It will be diffuse uptake. The options of management, starting from a pharmacological, radiotherapy, and or radiation, and the last by surgery if there is compression signs, along with multidisciplinary team approach, which you didn't mention at all, Dr. Sarah. Multidisciplinary team approach is very important in this patient, starting from the endocrine, thyroid surgery, and the ophthalmology, and physiotherapy, social worker, and so on, GP. Yes. I think we covered the whole topic. Yes, polyglandular, as I mentioned. Thank you, Dr. Morda. Type 1. No, it's not type 1, it's type 2. Polyglandular type 2. X-ray for intestinal goiter, along with also CT. Okay, any question or any inquiry, any adding comment? I know the time is late. I'm sorry for the lengthy session today. Any question? Any comment? Anyone awake?
Yes, no, thank you, doctor.
Thank you,
so
Dr. Bassem.
Okay, thank you, Dr. Awatel. Thank you, Dr. Sarah. If no question and comment, we can end the session. We'll see you tomorrow, inshallah, with the communication day. Thank you all. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.
much. No.